Come along for a day in the life of a transplant surgeon at Atrium Health Sanger Heart and Vascular Institute in Charlotte, North Carolina. This is Megan Damrich. She's actually an APP, that stands for Advanced Practice Provider, but she's one of the only in the nation credentialed to be able to go retrieve organs. What that does for our team is allow more of our transplant surgeons to remain in Charlotte and doing more cases.
We are going to get a heart.
And it is wheels up, just about an hour ride to Chattanooga. Our team there getting off the plane. We travel with a group called LifeShare Carolinas, and they're really the link between generous donors and those waiting for those life-saving transplants. And that is a Sherpa pack. That's a commonly used device to transport organs and keep them viable as our team goes into the hospital now. Now it's time to scrub into the OR. Our team will be inside the operating room for several hours as they work to retrieve this new heart. Fascinating part of this process, there's other teams from all around the nation who also come to retrieve other organs. It's really a dispatch of life-saving organs, and they're sent all around the nation and helping other people.
We're waiting for Megan to tell us whether or not this heart is acceptable for her patient, and if it is, we'll start opening the cooler to get it ready to package up and take home.
And this is the moment we've all been waiting for. The heart is good and is ready and viable to be transplanted. So the team is going to hook it up to this machine, put it in that solution that's going to keep it safe for the transport back. And from this point, it really is a quick ride back. There is a waiting ambulance outside the hospital. It's code 3 to the airport. That means lights and sirens. This really is an effort to get the organ back as quickly as possible and into the hands of our OR team at Atrium Health Carolina's Medical Center. So wheels up from Chattanooga, the team gets back on that waiting jet, just over an hour ride back to Charlotte. The team, as we are making our way back to Charlotte, they're preparing an OR at CMC and getting ready to retrieve that heart. This is Dr. Eric Skipper. He's one of the cardiothoracic surgeons at Atrium Health Sanger Heart and Vascular Institute. And at this point, that heart that was transported back to us is getting into the patient, is going to be placed inside of that patient, a life-saving procedure, a life-extending procedure. And this lasts several hours as well. The team there meticulously working and preparing this, and that is a heart beating inside the chest of a patient, time there on the wall. And the team really wraps this up, and another successful heart transplant at Atrium Health, another life saved.
It's truly a team effort. Everything from pre-op evaluation to the team in the OR, and then the team it takes to take care of these people for the upcoming years. It's a team sport.
More lives saved, more moments extended, and that's a day in the life of our transplant team at Atrium Health Sanger Heart and Vascular Institute.